So I get the question on a frequent basis of when am I ready to have a joint replacement? Well, it may be sooner than you think. What it comes down to is when does that joint affect your ability to perform the things that you want to do on a daily basis? Now that may be different for everybody. There are some people who are very, very active and they're not able to do those types of things, whether it's hiking or whether it's the higher impact activities. But for some people, it may be that they have more of a sedentary life and they just want to play with their grandkids and they want to walk and they want to be able to walk to the football game and not have pain in their joint. Also, what we look for is, does this affect your sleep? Is it causing big problems in your life? And when it does, it's time to have that joint replaced. Now, for some people, they may be young, for some people, they may be older. I think it's really important to have that conversation with your surgeon because it's not the same for everybody. We see that there are negatives to waiting too long for joint replacement. One of them is, as arthritis worsens, there can be increasing deterioration of the joint. This may make surgery more complex. Sometimes we have to use bigger implants and more constrained implants to get the motion that you want. In the case of hip arthritis, the affected leg can actually shorten as cartilage and bone wear away. Also, as arthritis progresses, the joint moves less. This means the muscles and ligaments around your joint may contract, causing stiffness. One of the other negatives to waiting is that we know, especially in the knee, the amount of motion that you have before surgery is a direct correlation to the amount of motion that you have after surgery. So you don't want to wait until the affected joint has significantly limited your mobility. Your muscles surrounding the joint also weaken when you use the joint less and less due to pain. This can make rehab after surgery more difficult. If your muscles weaken a lot, they may never regain full strength. As our hips or knees or any of our other joints get worse and worse, most patients aren't able to walk as far or aren't able to stay as active as they want to stay. And we know that we have to burn those calories, and that's the goal of orthopedic surgeons, is to get patients active and get them moving again. I've never had a patient come into my office saying, I wish I would have waited to have this joint replaced. But on a daily basis, I have patients that come in and say, I wish I would have gotten this joint replaced sooner. One of the things that gives me the most satisfaction in my career is having a patient come in telling me that I was able to help them get their life back. Patients that do the things that they really want to do without pain.